Hi, my name is Sarah. I am going to be demonstrating our physical assessment competency. For competency, you will have 4 scenarios and you will randomly pick which one. So the first one that I'm going to demonstrate all the way through is the neuro assessment. That way, or the neuro patient, that way you can see how I can incorporate the neuro assessment into the full assessment. Okay? All right, so here we go. All right, washing my hands. Knock, knock. I'm coming in.
Okay.
Hi.
Hi.
How are you?
I'm good.
Good. My name is Sarah.
Hi, Sarah.
I'm going to be your nurse today.
Oh, good.
Okay. And can I get your name and date of birth, please?
Stephanie Hutchins, May 20th, 1968.
Okay, good. And do you like to be called Stephanie or Miss Hutchins?
Stephanie.
Stephanie's fine? Okay, good. Are you in any pain right now?
No, just my hand and leg feel funny. But
Okay.
Yeah.
All right, we'll get more into that.
Okay.
I'm going to do some safety checks real fast.
Okay.
Okay, so I see that your bed is low and it is locked. Yes. Your alarm is on. The side rails are up and you have your call light right here. And you're able to use that? You can use that? Okay. All right, so I have a few questions to ask you, and then we're gonna get into your physical assessment is what I'm here to do right now, okay? So we got your name and your date of birth. Now, can you tell me the year, please?
2023.
Very good. And where are we right now?
We're in the hospital.
Okay, and what brought you into the hospital?
I had a stroke.
You did? You had a stroke. Okay, very good. So my patient is alert and oriented, and so I now can move on. That was my focused part of the assessment, the first part, and now I'm going to move on to the rest of the assessment. Okay, so next I'm going to check your tubes here. So I see you have an IV running, and it is the correct solution, and it's running at the correct rate. And I'm going to follow it down here, and I'm looking at your IV site, and I don't see any redness, no swelling. Is it tender at all?
No.
No tenderness. Okay, so the IV line is patent and it is running, and there's no sign of infection or infiltration. Okay. The other one thing I'm looking at, I see you still have a catheter, so I'm going to look at that, and I'm looking at coca. And I'm also making sure that the dependent loops here are going to be up on the bed. Okay, so that's not hanging. Hopefully we can get that out soon.
That'd be great.
Okay, so I'm looking at that. That also looks patent because you have urine going into the back, and I see coca. All right. The other thing that I am noting here as I am talking to the patient and assessing is that I see her color is good. She doesn't seem to be having any issues breathing. Do you feel short of breath or anything? No? Her chest contour is symmetrical. I see that there is no no drainage coming from her ears or her eyes or her nose. And so now I'm gonna get started with the rest of it. Okay, so I'm gonna move the bed up for my safety here. Oh, wrong way, sorry. That happened. All right, now I may or may not be wearing gloves in this situation. I don't always. Okay. Does that feel okay? All right, so first I'm gonna look at your eyes here. So I have this light. I'm gonna shine it into your eyes. I just want you to look straight ahead.
Okay.
Okay, I'm gonna put this down so that I can get a little closer to you.
Okay.
All right. One left hand. Okay, so just look forward. There's mine. There it goes. My light working? My light
Now
died.
it is.
Okay, so I'm looking at both the eyes. The second time I looked at both at the same time. So your eyes are perla, the pupils are round, equal reactive to light. Okay, and then for accommodation, I'm gonna have you follow my finger, please.
Okay.
Go in, and I'm gonna go out. Good. So your eyes are accommodating.
Mhm.
Another thing I'm gonna do here is I'm gonna have you look at this
Okay.
and follow it, please. Okay, you're gonna go this way. Yep. Okay. Very good.
Okay.
Okay. Can you raise your eyebrows, please? Very good. Very good. And you're smiling. I see
Okay.
that your smile is symmetrical.
Good.
Okay. And you were able to raise your eyebrows. Can you stick out your tongue? Good. Tongue is midline. I don't see any drooping.
Good.
Can you also open your mouth for me? Let's see. It'll work. Say ah. Can you move your tongue? Side to side. Okay. I don't even see any cheeking or pocketing. So I know that her cranial nerves are intact as well, and there's no cheeking, pocketing of food. I'm also going to check your swallow.
Okay.
I'm going to put my fingers here. My hands are cold. Sorry. Can you swallow for me, please? Good. Okay. And swallow is intact. Okay. So another thing, just while I'm right here, can you shrug your shoulders?
Mm-hmm.
Good. All right. So now we'll do more with the physical part of it,
Okay.
but I'm going to listen to your heart and your lungs.
Okay.
Okay. And I already kind of mentioned that chest contour was good and equal, symmetrical. So now I'm going to listen. So in the testing situation, we would listen with the double stethoscope with your instructor. Okay. So I'm going to listen here. First I'm going to clean this for you.
Thank you.
Cleaning. All right. Okay. All right. All right. So I'm just going to listen. You just breathe normal.
Okay.
You gurgled. Okay, good. So her heart sound has a regular rate and rhythm. And now I'm going to listen to your lungs.
Okay.
Okay, so I'm going to go on the front, two points on the lateral, left and right here. So take a deep breath in, please. Yep, through your mouth and out. Good. Good. Okay, so the anterior lung sounds bilaterally are clear. I hear no adventitious sounds. And I am going to sit you up, actually, so I'll put the head of the bed up a little bit so I can listen to the back of your lungs.
Okay.
Okay there? Oh, there you go. Look how well you're moving.
Yeah.
That's so good.
I did that.
You did. Okay. All right, so on the back, I'm going to listen on 4 points, kind of mid-back and lower back. And then also the 5th will be on the right under the axillary, that kind of mid-axillary. Okay. So again, when I place the stethoscope, take a deep breath in and out. Good. Okay. Lean forward a little bit more. There you go. Very good. Beautiful. So those sound clear. I'm also assessing your back while I'm looking here. So I see your skin is clear. I don't see any rashes or anything. So I'm going to get that last side under here, and I would normally do it under the clothes. Okay, go ahead. Because I can't hear it this way. Go ahead. Okay, good. So her posterior lungs are clear bilaterally, no adventitious sounds. I heard you coughed a little bit, but was that
just felt like I needed to?
Okay, but I didn't hear any adventitious sounds back there. So clear bilaterally. Okay. So from here, and again, I'm assessing your skin as we're going. So now I'm going to assess your arms and your hands. So I looked at your IV already. Again, I'm looking at color. Right? I don't see any bruising or anything. Your hands are warm. Okay. Now, can you please raise your arms up? Good. So this is, I'm assessing for drift. So see, her arm is coming down a little bit on the left side. So a little bit of drift on that side. Okay. And now can you hold them both up here? Can you push down? All right. So stronger on the right, a little more affected on this side.
Mm.
Yeah.
Mm-hmm.
Okay. And what about up? Can you go up? Push up a little bit. This side. There you go. Okay. Good. And now I'm going to assess grip. So I'm going to take this hand and this hand. If you could squeeze my fingers, please. Oh, not as much there. So grips are not equal on both sides.
Okay.
Okay. So we're working on that.
Mm-hmm.
Yeah.
Mhm.
Physical therapy?
Yeah.
Okay.
Yeah.
Good.
Twice a day.
Good. There's your IB. Don't lose that.
Don't lose that.
Okay. All right. Now I am going to assess your abdomen.
Okay.
So I'm going to lay you back down.
Okay.
Okay.
Oh, I was able to do that.
Mm-hmm. See, look at you. You're moving already.
Yeah.
Okay, good. All right, so I'm gonna lift this up. We'll keep you private here. Very good. Okay. So first, I am assessing. All right. So I am assessing, and I don't see any bulges. I do see some scars, though.
Mm-hmm.
In reality, we are truly assessing each other here. So I need you to actually assess what you see.
Mm-hmm.
So I do see some scars. What were those from?
Oh, I had what do we call it? A hernia repair.
Oh.
Yeah, down there. My stomach
there?
and my esophagus needed
Oh.
helping.
With all of these too?
Mm-hmm.
Wow.
Yeah,
Okay.
they did it endoscopically.
Okay. All right. I'm gonna listen now.
Hiatal hernia. Hiatal hernia.
Hiatal hernia. Okay. So I'm gonna listen. Did you just eat lunch?
It's working.
Uh-huh. There you go. All right. So bowel sounds are present in all 4 quadrants. And now I'm gonna palpate.
Okay.
Just tell me if you feel any pain.
Okay.
Okay. Just a gentle kind of push. No? No pain?
Mm-mm.
Okay. When was your last bowel movement?
Today.
Today?
Mhm.
Everything was normal
Mhm.
for you?
Yep.
Yeah? Okay.
Yeah.
Good. All right. So we can put that. So no pain with palpation, no distension. So now what I would check is I go down to the GU assessment, right? She had a Foley catheter. So I'm going to assess that a little bit more. Make sure there's no rashes, pain, things like that before I move on. Okay. So I would do that. And now I'm gonna move on. Are you okay with your head down, or you want it up a little bit?
No, I'm good. Comfortable.
Okay. Now I'm gonna move on to your feet.
Okay.
I'm gonna pull this up. Did you take your socks off already?
did.
You did. She already took her socks off. Okay. So, again, that's up, so I can move over here. Again, I'm looking at skin, right? All the way down, I'm looking at skin. I don't see any swelling in her feet or her ankles. Any numbness or tingling
No.
in your hands or your feet?
Mm-mm.
No?
Mm-mm.
Can you wiggle your toes for me? A little bit more on this side. Yeah. Not as much on this side. Okay. If I was to touch your left foot, can you feel which toe I'm touching?
Yeah, my big toe.
Good. Okay. And this one?
No toe.
Good. Very good. Okay. So you can wiggle a little bit, not the same here. I'm gonna have you push up towards your head with your toes.
Okay.
Okay, good. So more strength on this side, on the right. Okay, and push down like a gas pedal. Okay, same thing. All right, good. I am gonna check pulses now. Okay, so dorsalis pedis pulse on the right is present, and posterior tibialis. Maybe I can find. Yes, present. Okay, I'm gonna do this side. Present on this side. Maybe it's harder to find on this side. Okay, present. Now I'm going to do cap refill as well. Cap refill is less than 3 seconds. Your nail beds look good. I'm going to check between your toes. And I'm also going to check heels. Okay, no skin breakdown. Okay, one more thing strength wise. Can you push up with this leg?
Mhm.
Very good. And can you push down?
Mhm.
Good. And push up. Push down. Okay. Not as strong on that side, so we're still working.
Mhm.
This is an improvement though from last time.
Good.
Yes.
That's what I
Yes.
want.
Good. Okay. So CSM is intact. There's a little bit more weakness on this side, on the left. Okay. But she had a left affected side. All right. So I did everything down here. Yeah, I think so. Okay. So one more thing. I'm going to wash my hands. Is I'm going to look at your bottom because I need to check the skin on your bottom and more of your back to make sure there's no skin breakdown there. Okay? So if you could turn over that way. Oh, look at you. You're moving so well. There. Okay. So I would check here. Again, I'm checking more of the back. I'm checking the coccyx area. The skin is intact. There's no redness. It's not tender or anything. No?
Nope.
Look good? Okay.
Yeah.
All right, that looks great. You can come on back. Okay, and that was our physical assessment
Okay.
with the neuro assessment mixed in.
Mm-hmm.
You did very good.
Thank you. So did you.
Thank you. All right, so now I would lower the bed and I would do my safety exit out. Okay, let you know I'll be back in a little bit. I'll do my safety exit out. Okay.
And our patient does not need to have symptoms
No.
in the competency.
Okay, so that was neuro. I'm gonna go over the other ones really fast as far as what is focused first and what you're gonna focus on is when you walk into the room, right? For the neuro assessment, I needed to know she was alert and oriented before I moved on to everything else. Because if she wasn't, and that was a new finding, we'd have to address that. So let's do our surgical.
Okay.
All right, so if I had a surgical patient, I'm gonna move you up a little bit. Oh, it turns off. All right, so the first one I will do is abdominal. So if your patient is going to be the one with the abdominal surgery, what you're gonna do,
Does she have a front or a back?
no.
Okay.
Okay. So I keep saying so. What you're gonna do is you're gonna walk in. Obviously the bed would be low. You're gonna walk in, you're gonna introduce yourself to the patient and tell them what you're going to do. You can check name and date of birth, make sure you have the right patient. You're doing your safety checks because you would be doing those kind of as you're talking to the patient. The next thing you need to focus on is the abdominal dressing. Okay, so before we move on to this or anything else, I need to make sure she's not bleeding, right? We don't want her to be bleeding out while I'm looking at her eyes, okay? So I'm here, I'm gonna look at your dressing, right? I introduced myself. I'm gonna look at that. Okay, great. So the dressing is dry and intact. How's your pain?
Just a little bit, maybe 2 out of 10.
2 out of 10? Okay, and that's
It's
tolerable
there.
for you? Okay.
Yeah.
Great. All right. So as long as this is dry and intact, I can either focus on my abdominal assessment now, or I can go now through the rest of it. When I come back to the abdomen, I am for sure listening. The main thing here is I am not palpating. So that will cause more pain, and we already know that there's pain here. So this is the difference here is we are listening, we are not palpating, okay? And we have this dressing. The other thing that's different with this patient is when I need Stephanie to roll over to look at her abdomen or to listen to her lungs, I need to splint. So either I have to pull Stephanie all the way up with the bed and a pillow to listen to the back, or I splint her and she will roll over. You're gonna hold on to this against you to more pressure, counter pressure.
Okay.
And you're gonna roll over that way, please. Okay. Then I'm gonna look at her coccyx, I'm also gonna listen to lungs if I haven't done that already. Okay, so I'm gonna do that. But the big thing is that she has to splint. Okay, so that's the big difference with this one. So I'm gonna check the dressing, then I'm gonna go back through everything else. All right. If it is the knee surgery, let's pretend here. knee surgery. Okay, same thing. I'm gonna walk in. This bed would be low. And I'm going to introduce myself. Hi, Stephanie. My name is Sarah. I'm gonna check name and date of birth. Make sure I have the right person. I'm gonna do my safety checks. Then I'm gonna check your knee. You had knee surgery,
Yes.
so I'm just gonna check the dressing real quick.
Okay.
Okay. So I'm looking at this. I see that it is dry and intact. I can compare some symmetry between these knees, right, and her legs. Make sure there's no swelling or redness happening, no sign of infection. Okay, that looks okay. How's your pain?
Oh, about a 3 out of 10.
3. And is that tolerable? You feel like you need
No, I'm okay.
Okay.
But maybe later.
later? Okay. So I'm looking at that. I'm asking about pain for both surgery patients, for sure. Then I can move on to the rest of my assessment. Look at my tubing, everything. Then I go into head to toe. When I get down here, I am going to, the difference here, CSM is important for everyone. Here, I am paying a special attention to the affected side, okay? The one that had surgery. So I'm looking again for swelling, I'm looking for sensation, movement, right? Can you wiggle your toes?
Yeah.
I'm looking at skin, I'm checking pulses, cap refill. For this one, I'm also gonna do this differentiation because this is the affected side. Can you feel when I touch this toe?
Yeah, my big toe.
Big toe
Mhm.
and this toe?
My little toe.
Okay. I also, can you push down on my hands?
Mhm.
Good. Okay, and back up. Good. So I'm assessing strength too. And if this was a fresh surgery, she may be numb down here and may not be able to move this foot so well.
Mm.
Okay.
Mhm.
So I'm assessing
Right.
that. I know you are. And those are my differences. for
And
that.
I like that I feel safe because my rail is up
Yes.
when you're down there.
Yes, yes, yes. Okay. So now for the pneumonia patient, I will, same thing, walk in. We're going to pretend this patient is pneumonia and debilitated. So not just pneumonia, but pneumonia and debilitated. So the difference is here, my focus. Again, I'm going to walk in. I'm going to introduce myself. I'm going to say hi to my patient, make sure I have the correct patient. And then I'm going to focus now, I'm going to do my safety, sorry. And now I'm going to focus on the breathing even more. So I want to make sure as soon as I walk in that her head of the bed is at 30 degrees, which it is. If it was not, I would move it up. I'm also going to ask, how are you feeling? Tired. I'm sorry. Are you having any shortness of breath?
No.
No
just
shortness of breath.
pooped.
Just kind of pooped and not feeling good.
Yeah.
Okay. Well, I'm here to do your physical assessment,
Okay.
and hopefully we won't move too much. We're not going to
Okay.
do too much. Okay. All right. So I am, again, I know she's not short of breath. Her head of the bed is up.
Mhm.
I'm looking at chest contour. I'm not hearing anything, any auditory wheezes or sounds. She's not coughing. She's not blue. She's not struggling. So I can either do my lung assessment now, or I at least know that part of it, and now I can move on to everything else. If she was struggling, this is gonna be the main focus. But we know she's doing okay. She's not short of breath. So I'm gonna move on to the other things. Again, I start with the tubes. I lift her bed up. I'm looking at the Foley, and then I'm gonna assess the rest of her.
Mhm.
Okay, her eyes. We're looking at face symmetry and everything.
Mhm.
The other thing that we're gonna do with this patient is, and I can ask the questions.
Mhm.
Tell me where we are, please.
In the hospital.
And what brought you here?
Breathing.
You're breathing. You're having trouble breathing,
Mhm.
but you're feeling better now.
Yeah, better.
Little
Getting
bit.
better.
Little bit.
Mhm.
And what year is it, please?
Oh gosh, 2023.
Very good.
Mhm.
Okay. So I am also going, as we go through the face and go down through here, is we're going to ask this patient to open their mouth and move their tongue around so I can check for cheeking and pocketing. So I don't see any of that.
Mhm.
And I'm also going to ask you to swallow, please. Very good. So her swallow is intact.
Mhm.
All right. And then I'll move on from there.
And I'm feeling good breathing at this with my head up, but
Mhm.
please don't lay me flat.
Okay. I will not lay you flat.
Okay.
So when we turn over,
Mm-hmm.
when we roll over, are you okay rolling over with your head
Yeah,
up a little
I
bit?
think I can.
Okay, so we will not lay this patient flat because she may not be able to breathe. So we'll have to turn her over, and I can turn her over to listen to lungs because she's weak and can't sit up, possibly. So we're gonna turn her over, listen to lungs, and look at the coccyx.
Okay.
Okay?
Mhm.
All right. So that is your physical assessment in a nutshell here. As best we could do. Thank you. Yes.